right, so the first thing I'm gonna go ahead and teach you guys is the finger sticks, okay? So the first thing I'm gonna do is set up my supplies. And what I'm gonna need for my finger stick is my most common supplies, which is a gauze. I'm actually gonna get 2 gauzes.
Are your hands sterilized?
I'm actually gonna do that right now. Alcohol. And then I'm gonna need the equipment for my finger stick, which is my lancet and my collection tube, which I'm gonna go ahead and do it on this little tube right here. Okay. All right. And then that should be it. And of course I have my hand sanitizer and I have my sharps container so I can put it there. And I need my gloves. All right, so for the finger stick, which are the 2 fingers that we are able to poke?
The index.
Index and the middle finger. The ring finger and the middle finger.
Ring and index.
Ring and middle finger. These are the only 2, okay?
Oh, no.
So what I'm gonna go ahead and do first, I'm gonna go ahead and sanitize my hand. Because for this one, I don't have to be searching for no veins or anything. And I know that it's kind of cold, so why don't you just go ahead and put your hands underneath your legs just to warm them up while I'm getting prepared.
I think with the purple guy.
I'm gonna apply my gloves. All right, and the first thing I'm gonna do is clean my finger that I'm gonna draw from. All right, so I'm gonna use the ring finger, and I'm gonna use this side right here. And remember, we don't do the fingertip, we do right on the side. All right, now you could either puncture either side, but since I always puncture with my right, I like to puncture on this side. Now, if you're left-handed, well, it's more easier on this side, or if not, then you would kind of just have to change your position so you'll be able to do this side. Because if not, it's going to be hard to be doing this, okay? So I'm going to go ahead and do this side right here. I'm going to let it dry. And then this is my lancet. This is what I'm going to use to puncture. For this one, I have to remove the tip, which the only thing I have to do is twist and pull, okay? That's plastic. And then I'm gonna grab this like this. As y'all can see, it's kind of like oval. So I'm gonna grab it. I'm not a smoker, but you're gonna grab it like if you would grab a cigarette, just like that, okay? And I'm just gonna go ahead and now that it's dry, go ahead and place, make a fist, and then like that. I want it in downward position because I want all that blood flow going down to the fingers, okay? Come this up. All right. So what I'm gonna do, I'm gonna use my hands as a tourniquet, because what I want to do is I want to be able to hold that blood flow. You see how it turns real red on the tip? So I want to be able to hold that blood flow there so I can get a pretty good amount of blood, okay? So I'm going to go ahead and squeeze it there. And remember, it's going to be contralateral, right? So it's going to be right on the side. And I'm going to puncture 1, 2, 3, ready, poke. This goes automatically in your sharps container. And what I'm gonna do, I'm gonna go ahead and clean the very first drop of blood, because remember that could be contaminated with tissue or alcohol, okay? So like this tube right here, if y'all see, it has a little blue line. That is a maximum line. So I wanna collect from the other side. And I wanna go ahead and collect it with it this way, in this angle. And what I'm gonna do, I'm gonna get a very good squeeze, good drop, place it close, and it absorbs it. Okay, and just keep on getting a good amount of blood and then squeeze. Because if you do little by little, it's going to take long to fill and it could get clotted. Good drop. More. Okay, make sure that you get a good. Just keep squeezing. Blood is coming in. All right, now that it's maxed to the line, what I'm gonna do, I'm gonna place my finger here on top. I'm gonna get the gauze, fold it in 4, have her hold pressure. Can you please hold pressure to your finger? All right, now The reason I do this, because it's kind of like a straw. Like when you're gonna give like a drink to a baby, you put the straw in, right? Put the finger so it can hold that drink in there, and then when you're gonna let it go, what do? Release your finger and it drops, right? And I don't want that to happen. If I take my finger off there, guys, and I have it like this, my blood is gonna be coming out, okay? Now, I don't wanna see your finger either here as you're collecting, because if you have your finger here and you're trying to collect blood, it's not gonna come in, because you're basically covering that vacuum, okay? So, one of the things that I didn't get, we have a clay sealer, okay? So what I'm gonna do with my clay, I'm gonna come in here and just kind of like, it's glass, so you have to be very careful. Just kind of push down, okay? And what it's gonna happen, that little clay is gonna form like a little top to it. So now my blood is not gonna be moving from there, okay? So that is a reason too why I grab it like this, guys, because if I do this, if I'm collecting like this, what's gonna end up happening, the blood is gonna keep on moving down and it's gonna form little spaces as you collect. So that means that if I have space of air here, space of air here, space of air here, am I collecting the right amount of blood? No, because there's spaces in there, there's air, all right? So I want it intact like this, where there's no spaces at all in my blood. You see that? Okay, that way I know that I actually got the quantity that I'm supposed to, okay? So that's it. This right here, we could either put like the label folded, right, with the patient's information. Another thing you could do is maybe get a blood tube that doesn't have like any additive or anything and put it in there and label the tube. So there's like different ways that you're able to label these tubes, okay? And then you send them out to the lab. Now that I'm done, I'm gonna go back to my patient. Make sure that it stopped bleeding, which it did, all right? And then what we can go ahead and do is just apply another clean gauze, place it over, can you hold it please? And then I'll just go ahead and get some tape.
For those, you don't put a Band-Aid?
You can put a Band-Aid, you could put tape, whatever you want to put. And just kind of wrap it there. Just so it can stay there in case it's still bleeding.
Are these mainly for like glucose tests?
Mm-hmm. Yeah. And that's it. That's all we do for the capillary. Any questions? No? So like this one, since I'm going to discard it, where would I discard it at?
Biohazard.
Biohazard container?
Sharp.
No,
sharp,
because it's glass. Right? So it goes right in here. All right, and that's it. I'm done.